Hello, everyone. Welcome. This is Dr. Scott Gray here. Welcome to Top Minds, where we talk about the top minds in healthcare and business and life, such as the founder of the Orlando Magic, Pat Williams, and so many more, and how they're making a difference in the world today. I'm also the founder of over 10 healthcare facilities, Gray Marketing Enterprises, and really training businesses to help doctors get to grow their best practice and to help as many patients as they possibly can. And this episode today is brought to you by Gray Marketing Enterprises, where we help doctors so they can focus on their specialty and what they're doing, taking care of the patients, and we can get your message out to people that need to hear it and need to use so they can find you. To find out more about Gray Marketing Enterprises, go to gmedigital.com. That's gmedigital.com. Now, today in the podcast, I'm super excited to have with us today Dr. Vernon Williams out of San Antonio, Texas. He is a soft-spoken, tireless, energetic, really caring physician. I've known Dr. Williams for a couple of years now, and he really has an astute grasp of the big picture. And although he's only 29, right, as we all are, he's been an emergency medicine physician for over 33 years now. And Dr. Williams considers the Wellness and Aesthetics Medical Center, his practice there in San Antonio, really his life calling. And Dr. Williams got his bachelor's from Harvard University. He received his MD from Albert Einstein College of Medicine, and he did 2 years of general surgery residency at Allegheny General Hospital, and then became a flight surgeon in the U.S. Air Force for 3 years. Now, Dr. Williams has extensive training in lasers and medical spa procedures. He's a fellow in the American Society of Laser Medicine and Surgery. He's got a diplomate and fellow in the American Academy of Anti-Aging, Regenerative, and Functional Medicine. Some people call that A4M. He's a fellow of stem cells, sports medicine, integrative cancer therapies, peptide therapy, and sexual health, all with A4M, and a member of the Anti-Aging Group Advisory Board. He completed physician training and certification in age management medicine, jointly sponsored by the Synergence Education and Research Foundation and the Foundation for Care Management. A huge intro for an awesome guy, Dr. Williams. Thank you so much for joining us on the show today.
Well, thank you, sir.
Yeah, well, Dr. Williams, I want to jump into something with you. Before we started talking, before we started interviewing here, we took a couple minutes to chat. And obviously right now, you do still do some work in the ER. And today is July 29th, 2020 that we're recording this. Obviously, it'll come out a little bit later. But right now, being in Texas, you're starting to see COVID cases come down a little bit. Can you share with us just your experience over the last several months of what you've seen with coronavirus, how people are treated, how people are responding, and just kind of get your opinion on the whole thing?
Well, I have 3 different experiences. Experience number 1, myself. Number 2, my office, which is the Wellness Aesthetics Medical Center. And experience number 3 is in the emergency room. In the emergency room, probably about 20% of our patients coming to the emergency room are coming in because of symptoms that suggest they have COVID. And from those people that we see, the majority of them go home. Now, if you come in, let's say you come to the emergency room because you have diabetes or you have a knee problem and you need to be admitted, then you are tested for COVID. And if you're positive, you are admitted with a diagnosis of COVID, even though those were not the symptoms where you came from. So quite a few of our admissions are COVID admissions, even though they did not come in for COVID symptoms. Number 1, in my practice, in my office, none of my patients have had to go to the emergency room. And that's because we are very, very aggressive on treating our COVID patients. A lot of the talk that you hear is about the end game. They talk about what happens after you get sick and you're in the hospital. And that's when remdesivir is. It's an IV, so you have to be in the hospital to get it. Now, typically, in medicine, we always try to prevent you from getting sick. So we have to be aggressive to prevent you from having to get to the hospital. And that's the part that no one is talking about. I mean, typically in New York, when you got the COVID, you went to the emergency room, they told you that you had the symptoms, you weren't sick enough, and they sent you home and they said, take Tylenol. And then 6 or 7 days later, you felt you got worse, you went back to the emergency room, and then they said, well, you're still not sick enough to be admitted, continue taking Tylenol. 2 weeks later, you've already infected your whole family, and now you can't breathe. You go back to the emergency room, and they tell you, oh, you're so sick, you need to be admitted. And now they put you on a ventilator, where 80% of the people on the ventilator don't survive. You see, had they taken measures in the first 2 weeks, you wouldn't need to get to that point. And so in my office, when my patient complain of symptoms that suggest that it may be COVID, we are very, very aggressive in treating the patients right off the bat. Number one, even before we get a positive test, we start you on. We do use steroids, and we also use Zitromax, and we also use Plandifil, which is the hydroxychloroquine. And so we use that on our patients, and our patients do very, very well. We also use the inhaled steroids also. And of course, we use zinc, and we do IV nutrition, so we do vitamin C and vitamin D and all the things else that you need. And so none of our patients have gotten to the point where they've needed to go to the hospital. And so that's what we do for our patients. Now, as for myself, I take hydroxychloroquine as a prophylactic, and I've been taking it since early March. I've been taking hydroxychloroquine. And I've worked in the ER, I've seen lots of patients, and I've never had any problems at all. So that's what's going on from our aspect here in San Antonio, Texas.
Gotcha. So, and you talk about that aggressive prevention, and obviously what happened in New York. Now, was it just too early in New York? Do you think is that why they were sending people home at the beginning? That we just didn't understand enough, or was it lack of understanding or lack of resources? Why weren't they being as aggressive then?
It's probably a combination of things. I think because they got inundated, and when things get inundated, you get into a triage mode where you take care of you allow people not to survive so that you can take care of the mass as opposed to a few. And so I think that had something to do with it. Plus also that we didn't know a lot about the virus, and hydroxychloroquine became more political than it needed to be, because in medicine and politics should not be together. As physicians, we always have a lot of tools in our black bag. There's no one medicine for any one disease. There's lots of different things. Just because something works on someone doesn't mean it will work on someone else. So every time someone comes in, there may be several different choices for that patient, and the physician and the patient decide which option is best for that patient. I always tell my patients that there's 1,000 ways to get from San Antonio to Houston. Let's sit down and discuss which way do you want to get there. Do you want to get there yesterday? Do you want to spend a lot of money getting there? Less money? Do you want to get there quicker? How do you want to get there? And so how the patient wants to get there determines which medication you use. For instance, people who exercise. We know if you do 3 hours a day, 5 days a week, you can get better results than if you do 30 minutes 5 days a week, or if you do 30 minutes once a month. And between the doctor and the physician, you decide which way is best for you, and that will determine the outcome.
Gotcha. So, and I want to make a disclaimer here as far as, obviously we're just talking here. This is not medical advice. So, Dr. Williams is just sharing his opinion, and consult your medical practitioner in your area if you have questions on this. But I want to ask you, Dr. Williams, if you were talking to your mother or father or a brother or a sister, what would you tell someone to do at home, just as far as like a preventative measure to just kind of increase their likelihood of if they contract COVID, which it seems like most people probably will at some point, right? What gives us the best chance to get through it without having to go to the ER with the least amount of symptoms possible?
Well, number one, you got to improve your immune system. All right, your immune system is very important. You know, you have a jungle, and your jungle consists of all your animals, and your immune system interacts with your jungle. Anytime anything new comes into your jungle, your immune system gets alerted, and it decides to either attack it or leave it alone. So when the virus enters your jungle, your immune system says, "Whoa, who is this guy? I've never seen him before." And your immune system is supposed to attack it and destroy it. Well, it's the same thing with COVID. So if you improve your immune system, how do you do that? You improve your immune system by eating better, optimizing your minerals and your vitamins, healthy living. Those are all things that you can help. For me and my family, I recommend hydroxychloroquine. That's for me and my family. That's what I'm taking because I've had good results. All right. Now, that doesn't mean that that's for everyone. You have to talk to your physician and decide what is best between you and your physician. But that's what I use. All right. I also use zinc, vitamin C, optimize my vitamin D. We do all those things for our patients and for our friends and family. All right?
Yeah, awesome, very good. We'll kind of move away from the COVID talk. I appreciate all your input. Just with your experience, I'm always interested to find out everyone's experience and what they've seen, people on the front lines like you. But we'll kind of take a right turn here and go into, I met you really through working in regenerative medicine and that type of thing. So I want to ask you, obviously you've got this fellowship, you've done so much study and everything. What got you started in regenerative medicine?
Well, back in 1991, I had been, I've always been like 5'10", weighed about 150 pounds, 155. And in about a year's time, I gained about 100 pounds. And I went to my endocrinologist, and my endocrinologist diagnosed me with a pituitary adenoma. That's a tumor in my pituitary gland that secreted prolactin. And prolactin is the hormone that makes women's breasts grow when they get pregnant, prepares it for breast milk. It increased my estrogen, lowered my testosterone, and made me overweight. My endocrinologist started taking care of me, and 10 years later, I looked at myself. I was 290 pounds. I didn't like that, so I started looking around because I felt that I would die. Literally, I felt I'll get diabetes, I'll get high blood pressure, I will get heart disease, and I will die. So that's when I started looking around. And so, physicians, we normally do continual medical education. And in Texas, we have to do 24 hours of continual medical education every 2 years, which is 12 hours every year. I started doing 200 to 300 every week, every month. I was gone somewhere trying to learn something. And that's when I started getting into regenerative and wellness and other ways of doing things. And so that's how I got started in this field. I went to the A4M, and with the A4M, I started learning about regenerative medicine. First, I started doing wellness. And, I thought wellness was the same as regenerative medicine, but it's not. You see, wellness is about being normal. See, in medicine, a normal value is what 80% of Americans are. Medicine will never make you optimal. It won't. So in other words, if you were in school, a normal person would be a B or a C student. Someone who does regenerative medicine, they would be an A. So integrative medicine is more about repairing things, fixing things, making you better than wellness. And so initially I started with wellness, and now I'm into integrative medicine, which is optimizing your body.
Excellent. And so now, did you see yourself getting into this, or was this really, it sounds like it just really came from that search of getting to a point in your life where you had to find something new?
It was a gradual process. Initially, I started doing wellness and aesthetics. Wellness was just trying to make people normal, and when people started feeling normal, then they wanted to look better. You know, contrary to popular belief, sick people are not interested in sex. They're not interested in how they look. They don't care about anything. All they care about is getting rid of the pain and feeling better. So we started with wellness, and then we moved from wellness to aesthetics. And then we started getting into regenerative medicine. And then once we started making people feel like what I call myself abnormal, because I don't want to be called normal. Normal is the top 80%. That's what normal is. I'm abnormal, which means I'm in the top 20%, which is what I want my patients to be, abnormal. And that means that when you go see a doctor and your labs all say you're normal, that's not something to celebrate. You want your labs to say you are exceptional, and that's what we strive for. So now I do wellness, aesthetics, and sexual health and regenerative medicine.
Yeah, that's awesome. So if I don't take anything else away today, Dr. Williams, now I get to strive to be abnormal. So I never thought that would be a goal, but I like that. That's the new goal now. So what's different? Has anything changed in regenerative medicine since you started? Things that are better, worse? Like, what are the differences you've seen as regenerative medicine has kind of evolved over the last 3 to 5 years?
Oh, a lot has happened. You know, initially when we started doing regenerative medicine, we were mainly doing liposuction, and we were doing stem cells from your own fat. So we were getting people's own stem cells, and the stem cells is what actually repairs things in your body. See, in your body, you have growth hormone, which is your body's healing hormone, and then you have stem cells. All right? Now, let's say you break a bone. If you break a bone, you go to the orthopedic doctor, he puts a splint on it, and he says in 6 to 8 weeks it's going to be better. All right? And you go home, 6 to 8 weeks, you're better. How did that happen? That happened because your handyman, that's your body's handyman, which I call your stem cells, went about, your stem cells repaired the bone, repaired the tendons, repaired the cartilage, repaired the muscle, repaired the skin, and fixed the problem. That's what happened in the 6 to 8 weeks. Your stem cells fixed the problem. And you have stem cells in every tissue and every organ in your body. You have stem cells in your skin, in your hair, in your teeth, in your bone, in your heart, in your lungs, in your brain. And those stem cells in each of areas of your body, their job is to repair that organ. So the stem cells in your brain's job is to repair problems in the brain. The stem cells in your skin's problem is to repair problems in your skin. The stem cells in your heart is to repair problems in your heart. Now, when you break a bone, that's a disaster. And when there's a disaster, the stem cells in the area that's broken sends out an SOS. And all the stem cells in your body hears the cry and rush to the area to help out. That's a disaster. But in your body, you have lots of little what I call forest fires. These are the little fires that's going on in your heart, in your lungs, in your kidneys. These are not major disasters, they're just minor problems. Unfortunately, your stem cells don't get to all these minor little brush fires because they don't know where they're happening. Your growth hormone, which is part of regenerative medicine, is what alerts your stem cells to where the small forest fires are. It's the same thing as if you have a problem in your home and a handyman comes to the home. Someone greets the handyman and says the problem is in the bathroom, or the problem is in the bedroom to the left. That way the handyman knows where the problem is. Well, growth hormone is your greeter that tells stem cells where the problems are so that your stem cells can improve. So if you improve your growth hormone, That will help your stem cell function better. But ultimately, your stem cell is what does the job, and your growth hormone tells you where the problems are.
So obviously that we want that internal mechanism working as good as possible. How do people help increase their growth and, have healthy growth hormone?
Well, your growth hormone can be improved by lots of ways. All right? Number one, when you exercise, that helps your growth hormone. All right? If you eat healthily, good nutrition, those things help. Good rest, good sleep helps your growth hormone. Those are all things that help with your growth hormone. Now, we have something called PRP, platelet-rich plasma. Now, if you're an athlete and you're 25 years old and you injure your shoulder, you go to the doctor. The doctor puts a shot of PRP, which is platelet-rich plasma. What platelet-rich plasma does, it activates your stem cells wherever you put it. So PRP, platelet-rich plasma, I say what it does, it gives your stem cells an energy drink so your stem cells can function younger and healthier. Because contrary to popular belief, your stem cells age with you. So when you're 10 years old, you have 10-year-old stem cells. When you're 70-year-old, you have 70-year-old stem cells. And if you have a problem and you're 70 years old, that's because the stem cells were not able to repair the problem. So yes, as you get older, your stem cells doesn't work as well. So you may actually need younger stem cells as you get older to help fix the problem.
Yeah, great advice. And so, in regenerative medicine, obviously, as you're talking here, people can probably start to realize, how much there is going on with this. And there's been a lot of things, that the FDA puts out and whatnot and talking about, bad actors, so to speak, out there. So what I want to ask you is, what's the biggest pitfall consumers, people that may be thinking about regenerative medicine need to be aware of when they're searching for a doctor that's doing regenerative medicine? What are some of the pitfalls they can avoid, and what should they be looking for to make sure they're finding someone that, has the credibility and the knowledge to do the right thing for them?
Well, number one is they have to look for a doctor who's been trained in the field. Medicine is really strange. Once you get that degree that says you're a physician, you are then taking care of patients from what you learned. And typically, a doctor who's been a physician for 20, 30, 40 years, he's still treating patients the way he was taught. But it's called medicine in training for a reason. Your doctor needs to be up on things. I always say to myself, if I have a choice of getting an iPhone from 2020 or an iPhone from 2010, I want the iPhone from 2020. And that's because the iPhone from 2020 has more data. If the iPhone from 2020 has more data, it can solve more problems. So you need to look at the doctor that you talk to. What kind of training does he or she has? Is he still treating patients the way he used to? When you go to a physician who says, I've always done it this way, then maybe you ought to consider finding someone who's more innovative, who's looking at new ways to do things. Because I can tell you this much, someone who is looking for new ways and who is getting additional training, they are going to do a better job. I go to conferences all the time. Typically, I go to 10 to 15 conferences a year. And every time I go to a conference, I learn something new. My goal is to learn at least one thing new. Because no matter what I think I know, there's always someone who knows a little bit more. And if I can pick their brains, it's better because I can get more information. And so, yes, you want someone who is trained, who's been doing it for a while, and who is willing to try new things.
I love it. And so I like that word of advice that, anyone that's saying we've always done it this way, we might want to be a little bit leery about that. And especially it's like, we've always used this iPhone from 2010. It's like, no, we want the new one. We want the stuff that's working now. And obviously, regenerative medicine, it's changing so fast. There's always new literature, there's always new tests and new technology. So I really like that, and I'm going to start using that. Now, and what do you find, when you work with patients? Obviously, you come at it from that holistic view of wellness, regenerative medicine, all these things together. What do you find most important for patients who have treatments done, when they get regenerative medicine, whether it's PRP or, a stem cell tissue like umbilical tissue, that type of thing? What do you find most important for them to get the best results? Because I've always seen this in practices. It's a partnership, right? We do our part in the clinic, the medical doctor, the nurse practitioner, and then the patient has their part. What do you like to talk to people about, and what would you say to someone who's getting the treatment done? What can they do to improve their results?
That's a very, very important question. I find that the patient's mindset is very, very important to good results. Let me give you an example. Let's say that someone comes to me and their shoulder is hurting and they can't raise their arm very well. And I talk to them. And so let's say that I end up giving them a treatment, all right? And before the treatment started, they said that their shoulder was about 50% of where it used to be, all right? And I give them a treatment, and then after the treatment, there's several options that's available. Number one, let's say that the shoulder is now at 75%. That patient could say, one, that means that my shoulder improved 50% and I'm happy with it. Or that patient might say, my shoulder improved 50%, but I'm not happy because I wanted it to improve 100%. Or the patient might say, well, I'm so happy that it improved 50%. I think that I'm going to want more treatment to get it to 100%. Or the patient might say, for what I spent, I don't think that I got what I wanted. So it's very, very important that you find out what the patient's mindset is and make sure that the patient's expectations is in line with what the results will be. Very, very important. Because if a patient is expecting the shoulder to be better than it ever was before, maybe it won't be like that. That old saying, Doc, after the procedure, will I be able to play the piano? And you ask the patient, were you able to play the piano before? And well, if the patient hadn't been able to play the piano before, you shouldn't expect to play it after. So expectations is very, very important. That's why I find that when I do consultation, I take a long time educating the patient, making sure that we are both on the same page, because expectation is going to matter.
Absolutely. I think, honestly, that's probably the biggest thing I've seen as well with our clinics, when the doctor talks to them and the patient maybe feels like there was some over-promising going on. That's when problems happen. So realistic expectations, that's fantastic. So to any doctor out there, or if if you're looking for a regenerative doctor and you're talking to someone and it kind of seems like they're saying that they have like this silver bullet magical thing, you might want to think twice there too. If they're acting like this thing's going to make you play the piano when you've never been able to play the piano before, as Dr. Williams said. So that's really good, and I think it's something valuable to use when you're looking for a doctor to help you. So let me just ask you this. We've talked a little bit about COVID, regenerative medicine, and obviously a lot of the people that are looking for regenerative medicine have chronic pain, they've got joint pain. What are some action steps that people could start doing right now based on the advice that you've given today and what you've seen, just to have better health and a happier, healthier lifestyle?
Well, I'm a big believer in mind-body. How you think. I've never had a bad day. Every day in my life is perfect. You know why? Because it could be a lot worse. And the fact that I have my health, I am the happiest person in the world. So how you think is very, very, very important. when I do alternative cancer therapy, within 30 minutes, I could tell whether someone is going to do well with cancer treatment or not, simply by the way they think. So try to stay away from negative thinking. That is very, very important. You want to be around positive thinkers because energy flows from positive to negative. So when you're around positive people, their energy is flowing to you and gives you a good sensation. If you are positive thinking, your results typically will be better than if you're a negative thinker. Even with COVID, you know, we have managed to scare so many people that if someone gets COVID, they right away thinking they're going to die. And that puts them behind the 8 ball. Got to always think positive because there are treatments for it and you will get better if you think positively. So mind body is important. How you think is important, number one. Number two, sleep. Sleep is so important for your health. You got to sleep. All right? Exercise. Exercise is very, very important for you. Now, with COVID, it really irritates me when I see people walking by themselves in the park with a mask on, or they're in their vehicle with a mask on. Guys, you hurt yourself when you do that. Your immune system needs the environment. It needs the environment. You know, if you're working with rattlesnakes, all right, what do most people work with rattlesnakes? What they do is they give themselves small amounts of toxins. And over time, their immune system has gotten used to the toxin. So that day when the rattlesnake actually gives them a big bite, it doesn't bother them because your immune system is aware of it and knows what to do. When you are walking outside, you are getting tiny little boluses of all kinds of things. And your immune system gets used to your environment and starts preparing yourself. Like, for instance, when I work in the emergency room, when I walk into a room to see a patient, I put a mask on. But when I'm sitting at my desk, I don't wear a mask because I want to get tiny little amounts of viruses. If someone sneezes on me, there's probably a few million viral particles in that sneeze. But, you know, if I'm walking around and no one's around, maybe there's 500, 100 viral particles in the air, and my immune system sees it and starts saying, oh, what are these guys? And after a while, my immune system starts understanding there's a virus around, and pretty soon my immune system is prepared. And so when someone sneezes on me later on, my immune system says, I know these guys, I know how to kill them, and the immune system takes care of it.
Mm-hmm. Yeah, I love it. Well, great advice. So make sure you're focused on mind, body. You're focusing on the positive. You know, one of the things I've always done is I've got a journal that I have here that I always write something positive that I'm grateful for at the beginning of the day. You know, start your day off that way, focusing on what's good and great. One of my friends, a gentleman named Al Zeit, said he's going to die on the best day of his life, and he's determined to. So every day he gets up and makes sure that he has a great day, a happy day. So no matter what happens that day, he's going to die on the best day of his life. So if we can try to aim for that, not the dying part, but just that every day is your best day. And make sure you're getting your sleep. Obviously, so huge. Most people don't get what they need, and that's the foundation of all kinds of issues there. Exercise, and then, you know, protect yourself when needed, but make sure you're doing what you can to build up your immune system. Put yourself out there to the environment. Keep yourself safe, but at the same time, make sure that you are letting your body build up its natural defenses. So just great advice, Dr. Williams. Where can people go to learn more about you, to contact you, to work with you, Dr. Williams?
Well, you know, I'm 29. I've been 29 for a while, all right?
Well, you act like it. I feel like you're talking about the mind-body. I think
yes.
You take that to the next level. You are 29.
Well, you know, it's like this, you know, my brain doesn't know that I'm not 29. My brain thinks I'm 29. And what happens when my brain thinks I'm 29? My brain says, well, I remember how 29 years old was. So my brain says, since we're 29, I have to have more muscles. I have to have more energy. I have to be able to run faster, jump higher, have better sex. I'm supposed to do all those things because I'm 29. And so my brain go about making me 29. So I'm starting off with a big plus by being that. Now, so if anyone wants to get a hold of me, my website is very simple. It is Feel29, www.feel29.com. So feel29.com. That's the best way. Of course, you could always call my office. My office number is 210-495-8558. That's 210-495-8558. But the best one is just get me at feel29.com.
Awesome. Well, thank you so much, Dr. Williams. We're going to put that information in the show notes so you guys can look down below here and just click on that link. Check out Dr. Williams' website. See how you can feel 29 again and just really help to take your life to that next level so you're living your best, happiest, healthiest life possible. Dr. Williams, thank you so much for taking the time out of your busy schedule to join us today.
Well, thank you so much, Seth.
Yeah, have a great one.
Thanks. Bye.